So let's take a trip around the abdomen so that you can learn the names of the locations and landmarks that are important. Let's start right at the top. Right here is the xiphoid process. That's a little extension of the sternum. Just below that is the epigastrium. Epi means on top of, and gastrium means stomach. So the epigastrium is on top of the stomach, and the stomach is on top of the pancreas. So now you know two organs that are inside the epigastric area, that's the stomach and the pancreas. Okay, now let's move along the right costal margin. That's the border of your ribs on this side. As you move along, stop about midway. Put your fingers underneath your ribs there and take a big breath. You just checked for Murphy's sign. Now Murphy's sign is when you take a big breath that flattens your diaphragm, which brings down your liver, and with your liver comes your gallbladder. Now if your gallbladder was inflamed or irritated, and when you took a big breath, it pushed your gallbladder against the examiner's fingers, and you took a sharp intake of breath because of the pain, that would be a positive Murphy's sign. All right, we're midway along the costal margin. We'll finish our way along the costal margin where we get to our sides, or what we call flanks. We often refer to flanks when we talk about nephrolithiasis or renal colic. From the flank, let's move straight down to the hip, or the iliac crest. The hip is the bottom border of your abdomen on the side. As you move forward along the iliac crest, you'll get to the bump on the front, or the anterior superior iliac spine. All right, now that you're at the ASIS, or anterior superior iliac spine, let's draw a line between the umbilicus and the ASIS. Now if you move 1/3 of the way up that line from the ASIS, bingo, you're at McBurney's point. McBurney's point is the point below which most people hide their appendix. Okay, back to the ASIS. Now we're going to go down, way down, and find the pubic bone. Look how far down that is. Much further than most people think the abdomen goes. But indeed, the bottom border of the abdomen is your pubic bone. If you stretched a line between your anterior superior iliac spine and your pubic bone, you would have your inguinal ligament. That's the bottom border of your abdomen that kind of mirrors the top border, which is the costal margin. Costal margins form an upside down V at the top. Inguinal ligaments form an upright V at the bottom. ASIS, pubic bone, inguinal ligament. From the pubic bone now, we go to the left ASIS, or anterior superior iliac spine. Between those two is the left inguinal ligament, which forms the lower border of the left abdomen. From there, we go up along the left flank to reach the left costal margin. Follow the left costal margin all the way back to the xiphoid, and we're back to square one. One more thing we can do is divide the abdomen into 4 by putting a vertical and horizontal line through the umbilicus. That gives us 4 quadrants. The right upper quadrant, known for its liver and gallbladder. The right lower quadrant, famous for the appendix. The left lower quadrant, not very famous, but has some notoriety with diverticulitis of the left descending colon. And the left upper quadrant, not really famous for anything. And one more region we have to name, and that's the one around the umbilicus, called the periumbilical area. So in summary, we have the abdomen bordered by the costal margins on top, the inguinal ligaments on the bottom, and the flanks on the side. We have the epigastric area, the periumbilical area, and the suprapubic area. And we have 4 quadrants: right upper, right lower, left lower.